Hello there. In the last video, I introduced you to vowels. I explained what a vowel sound is, how vowels are produced, the main four parameters we use to describe the distinctive features of vowels. In this video today, I'm going to introduce you to the second category of speech sounds we call consonants. Three main questions. What is a consonant sound? How it differs from vowels? How consonants are produced? Or what are the articulators involved in the production of vowels? And number three, what are the parameters we use to describe distinctive features of consonants? In fact, the basic division of phonetic classifications, as we have seen last time, is exactly the vowel-consonant categorization. We've seen that a vowel is a sound produced with a relatively free passage of the airstream, with no obstruction of the flow of air from the lens. So what about consonant? What is a consonant sound? What do you mean exactly by a consonant? Actually, when it comes to consonants, it's the opposite. A consonant sound is one in which the airstream coming out of the lens is modified in the mouth cavity by some blockage of the air created by articulators. This means that there is a constriction or an obstruction of air in the vocal tract. So how do phoneticians describe consonants? What are the parameters that are used exactly to describe consonants? Actually, to describe consonants, phoneticians classify them according to what we call the PMV parameters. P, that stands for place of articulation, the M, that stands for manner of articulation, and V for the parameter of voicing. So three parameters: the place of articulation parameter, the manner of articulation parameter, and also the voicing parameter. According to the first parameter, we classify consonants according to where in the vocal tract the airflow obstruction occurs. When we say place of articulation, it's exactly about where the obstruction or the airflow is obstructed in the vocal tract. So in order to understand these places of articulation, it's very important first to get familiarized with the names of articulators in the vocal tract. So what are exactly the organs that exist in the vocal tract? The movement of the tongue and other articulators creates the constriction and obstruction, the reshaping the oral cavity in various ways to produce various sounds. In doing so, different places in the vocal tract are involved. So what are these places of articulation that are involved, and how do we call the sounds produced in each of the place of articulation? Okay, let's see some examples of the organs that exist in the vocal tract and that are exactly engaged or involved while producing consonants. Different places. For example, we have the lower lip and the upper lip. For example, also we can talk about the upper teeth and the lower teeth. We have also the alveolar ridge, which is exactly the place behind the teeth. Then we have exactly the hard palate, which is exactly the roof of the mouth. Then we have also, as you can see, the soft palate, or what we call the velum. We have also the tongue, which is one of the most active organs in the vocal tract. Then we have also the glottis and also the two cavities, the oral cavity and the nasal cavity. These are the main articulators or the organs in the vocal tract that actually involved in obstructing the air that comes from the lens, that is pushed from the lens, in order to produce, of course, consonants. So how sounds are actually categorized according to these organs, or what are the organs or articulators that are involved in the production of each of the consonant sounds? Let's see. The first place of articulation is the one that is actually behind the production of these three sounds: b, b, and m. In fact, in the production of these three sounds, what happens is that the air is blocked by bringing the two lips together. That's why these three sounds are called bilabials. So what are bilabials? Bilabials are b, b, and m. They are the sounds that are produced by blocking the air by bringing the two lips together. The second place of articulation is the one that is actually behind the production of f and v. So in the production of these two sounds, f and v, what happens is exactly the air is blocked by touching the bottom lip to the upper teeth. So we call them labiodentals. What are labiodentals? Labiodentals are f and v. They are the sounds that are produced by actually blocking the air by combining both the upper teeth with the lower lip. We say f and v. The third place of articulation is the one behind the production of these two sounds, th and th. In fact, in the production of these sounds, what happens is this. The air is actually modified by inserting the tip of the tongue between the teeth. That's why we call them interdentals. So the third place of articulation is called interdentals. Interdentals are two sounds, th and th. These sounds are produced by inserting the tip of the tongue between the teeth. However, for some speakers, the tongue merely touches behind the teeth, making a sound more correctly called dentals. So that's why we find these two terms exactly in the interdentals and dentals are actually used interchangeably, but they refer to one specific kind of sounds that are th and th. Another place of articulation is exactly the one behind the production of 7 consonant sounds, t, d, n, s, z, l, and r. In fact, in the production of these 7 sounds, what happened is that the air is blocked by raising the tongue to the alveolar ridge. So that's why we call these sounds alveolars. So alveolars are what? Are consonants that are produced by exactly blocking the air through raising the tongue to the alveolar ridge. Another place of articulation is the one behind the production of these 4 sounds, sh, j, ch, and j. In fact, you can find these sounds in many words like mission, like measure, like cheap, and like judge. So in the production of these sounds, what happens is that the air is exactly blocked by raising the front part of the tongue to the palate. So that's why we give them the name palatals or alveopalatal sounds. In fact, these set of sounds can be characterized or can be divided into 2. We have the palatals, okay, sh, j, ch, and j, and we have also the alveopalatals that are ch and j. Why? Because in ch and j, you can notice that ch is a combination of a t sound that we have already said that it's actually an alveolar with the sh sound, which is exactly a palatal. And also j sound is a combination of 2 sounds, the d, which is actually also considered as an alveolar sound, and j, which is exactly a palatal sound. So that's why you can find in some phonetic literature and phoneticians themselves, they actually call them alveopalatal sounds. So we have palatals that are sh, j, ch, and j, and we have also the alveopalatals that can be also another word or another concept that is actually used interchangeably with palatals, which refer exactly to j and j, and also can combine sh and j. Another place of articulation is exactly the one behind the articulation of these 3 consonant sounds, k, k, and ng. This class of sound is actually produced by raising the back of the tongue to the soft palate or the velum. That's why we call them Venners. So what are Venners? Venners are consonant sounds that are actually produced by blocking the air through raising the back of the tongue to the soft palate or the velum. You can find these consonants in many words. Let's take this example of the initial and final sound of the words cake, geek, and king. And also you can take the example of black, bag, and bang. So k, g, and ng are actually vowels. There are other sounds that are actually not consonants, but they are actually there, existing in the phonological system of English. These consonants are w, y, h, and e. Actually, these ones are not consonants, but they are actually, or they have a place of articulation that we need to mention now. For example, if we take the example of the y sound, the y sound is a palatal like the sh, j, ch, and ch, because in the production of the y sound, the blade of the tongue or the front part of the tongue is raised to the roof of the mouth, to the hard palate, but not enough to cause any obstruction. So that's why we're not going to consider the y as a consonant, but the place of articulation of y is exactly a palatal sound. As for the w sound, it is actually considered as a velar sound like k, g, and ng. Why? Because in the production of the w sound, it is actually noticed that the back of the tongue is again raised to the velum, but not enough to cause any obstruction with the velum. So that's why we're not considering again w as a consonant, but the place of articulation is exactly velar. But something interesting in the production of w is that while producing w, we also involve the use of the lips. We round the lips. So that's why in some phonetic literature you can find the place of articulation of w is exactly a labiovelar glide. A labio because we use the lips, and velar because we raise the back of the tongue to the velum, and it is actually a glide because it's not a consonant. As far as the h and the e are concerned, these are called, or these two sounds are again not consonants, but they are called actually pharyngeal glides. Why? Because they are produced in the deep part of the vocal tract. But the place of articulation again here is the glottis. So we call them glottals. For the production of the h sound, it is actually noticed that the air is actually flowing through an open glottis, preparing for another vowel to be produced. But for the production of it is actually, the glottis is completely stopped or closed in order to stop the air, which leads actually to the production of the sound. So h, y, and w are not consonants, but they have different places of articulation. So sound is a glottal, the h sound is another glottal sound, y sound is exactly a palatal, and w is actually a velar or labiovelar glide. There are other consonant sounds that are not in the phonological system of English, but we can find them in other languages like Arabic and also like French. We can mention three sounds: ch, r, and q. These sounds actually, or these consonant sounds actually are called uvulars, because the place of articulation here is, or involves, exactly the use of the uvula. So in the production of these three sounds, uvular sounds are produced by raising the back of the tongue to the uvula. So that flesh that is hanging exactly from the velum, what happens is that it actually touches the back of the tongue, which causes friction. So these three are actually called uvulars. For example, the r sound in French is often a uvular trill, symbolized or actually pronounced as r. Okay, the uvular sounds like q and r occur in Arabic. These sounds do not ordinarily occur in English. So that's why we find them just in Arabic and also French. So how do phoneticians describe these places of articulation in terms of distinctive features? Does it mean that if we talk about bilabials, we put plus bilabial for p, and m, and minus bilabials for other sounds? Does it mean that we put plus alveolar for alveolar sounds and we put minus alveolar for non-alveolar sounds? No. In fact, what phoneticians did is this. They exactly divided all consonants into two types. So they draw a line on the vocal tract to exactly differentiate or distinguish between those sounds that are produced at the front part of the mouth and those sounds that are actually produced at the back part of the mouth. So the line is exactly between the alveolar ridge, so the sounds that are produced in front of the alveolar ridge and sounds that are produced behind the alveolar ridge. So the name is this, interiors. Phoneticians came up with a name that refers to those sounds that are actually produced in the front part of the mouth. They call them interiors. So what are interiors? Interiors are bilabials, b, b, and m, labiodentals, f, v, interdentals, th, and th, and also alveolars, t, d, n, s, z, and l, and r. These are interiors because in their production the air is blocked somewhere at the front part of the mouth. When I say at the front part of the mouth, it means either at the alveolar ridge or in front of the alveolar ridge. But for those sounds that are actually produced behind the alveolar ridge are called non-interiors, or they are actually referred to as posteriors. Posteriors or non-interiors are actually those sounds that are produced by blocking the air somewhere behind the alveolar ridge. Like what? Like exactly the palatals, like exactly again the Venners, like exactly again the uvulars. Those sounds like palatals or velars or actually uvulars are actually to be considered non-interiors. So two types, interior sounds and non-interior sounds. Interior sounds will give them the feature plus interior. So the plus interior sounds are p, p, m, f, v, th, th, t, d, n, s, z, l, and r. And non-interior sounds will give them the feature minus interior. And here we're talking about the palatals, sh and j. We'll talk also about the velars, k, g, and n. And also we talk about the glottals, h and even the uvulars that are non-English sounds like ch, g, and also q. These are minus interiors, these are posterior sounds. Another category also that is actually involved or that is actually named by phoneticians is the one referred to as chronologs. What do you mean by chronologs? In fact, phoneticians try to describe the places of articulations because they have noticed that all or majority of consonants are produced by involving the tongue. So phoneticians try to understand what are those sounds that involve in their production the use of tongue. So they notice that the tongue is mostly active, but phoneticians try to describe just those sounds that are produced by the front part of the tongue. The tongue itself is divided into three main organs or three main areas. We have the tip of the tongue, we have the blade of the tongue, and we have the back of the tongue. It's like saying that the tongue itself is divided into two, the back part of the tongue and the front part of the tongue. The back part of the tongue is actually involved in the production of many sounds like the velars, and the front part of the tongue is actually involved in the production of many sounds like the alveolars, like the interdentals, and even palatals. So those sounds that are produced by the front part of the tongue can be also divided into two. We have those that are produced by the tip of the tongue, like exactly the interdentals, like exactly the alveolars, and the ones that are produced by using the blade of the tongue, which are, and here we can talk about exactly the two sounds or the palatals, like sh and j. So phoneticians came up with a name called chronologs. What are chronologs? Chronologs are those sounds which are articulated by raising the tongue blade, the front part of the tongue, either the tip or the blade. So only the chronolog consonants can be divided into two types. We have the apical, using the tip of the tongue, and also laminal, using the blade of the tongue. So what are chronologs? Chronologs are alveolars, s, z, t, d, l, r, and n. And we have also alveopalatals like sh, j, ch, and j. And we have also the interdentals, th and the. These sounds are called chronologs. Hence, we give them the feature plus chronolog. The others are actually given the feature minus chronolog because they do not involve the front part of the tongue. They either involve the back part of the tongue, like for Venners, k and g, or for other consonants that do not even involve the tongue, like bilabials and labiodentals. So we give them the feature minus chronolog. We call them non-chronolog sounds. So we give them the feature minus chronolog. So far, we have described several classes of consonants according to their places of articulation. Yet, you can notice that we are still unable to distinguish the sounds in each class from one another. For example, the sounds p, and m are all bilabials. But what are the differences between these sounds? What distinguishes each bilabial sound from the other? To answer this question, we need now to move to the second parameter we call the manner of articulation. So what is meant exactly by the manner of articulation? If the place of articulation is exactly about the place where the air is exactly obstructed in the vocal tract, the manner of articulation is exactly about answering two main questions. First, how air moves through the vocal tract above the glottis. And second, what kind of constriction is there in the vocal tract. When we say manner of articulation, we are actually trying to know how does air move through the vocal tract, and also we try to know through the manner of articulation what kind of obstruction is taking place in the vocal tract. To answer the first question about the manner of articulation, which deals with how does air move through the vocal tract above the glottis, let's try to understand exactly what happens. Exactly, in fact, when the lungs push air out of your chest through the vocal tract, the velum is either found raised up, blocking air from escaping through the nose, or it is not in its raised position, but lowered, allowing air to escape through the nose and the mouth sometimes. The result is the production of two types of sounds. We have nasal sounds, and nasal sounds are those which are articulated while lowering the velum, allowing the air to pass to the nasal cavity. Second ones are oral sounds. Those are sounds that are actually articulated while closing the passage of the airflow to the nasal cavity, pushing it all to the oral cavity. We have m, n, and n. These three sounds, in their production, it is found that the velum is actually lowered, leaving the passage for the air to go through the nasal cavity. So we give them the feature, or we call them nasals, hence we give them the feature plus nasals. But all other sounds that are actually produced through the oral cavity, because the velum is actually blocking the passage of the air to go through the nasal cavity, we call them oral sounds. And these oral sounds are referred to as minus nasals, or we give them the feature minus nasals. Second, the manner of articulation is also about what kind of constriction or obstruction is there in the vocal tract. In other words, the airflow can be released by the vocal tract in at least 4 distinct ways. Number 1, we have total obstruction. It's when exactly the air is obstructed totally, causing an explosive effect. Number 2, that's exactly what we call friction. Obstructing air partially while allowing it to squeeze through the obstruction, causing friction. Number 3, approximation. It is actually about narrowing the vocal tract with no obstruction or friction. And number 4, we have sonorous. It's exactly about obstructing the vocal tract at one point while allowing air to flow freely from another point, using or causing some musicality. So these are exactly the 4 types of obstruction. So total obstruction, friction or partial obstruction, approximation, and sonorous. The total obstruction as the first way of airflow release. We can find in this first way of airflow release the first category of sounds we call stops. What do you mean by stops? Stops are sounds which in their production the air is exactly completely blocked in the vocal tract. So we call them stops. What are stops? In English, we can find 4 categories of English stops. We have bilabial stops, we have alveolar stops, we have Venners stops, and we have glottal stops. The bilabial stops are p, and m. These are bilabial stops because the airstream is actually blocked by the lips. For the alveolar stops, we have t, and n. These are alveolar stops because the airstream is actually blocked by the tongue, making a closure at the alveolar ridge. Venners stops are also 3. We have k, g, and n. These are Venners stops because the airstream is stopped by a complete obstruction at the velum. As far as the glottal stops, we have only one, which is exactly the sound. The sound is a glottal stop because the airstream is completely obstructed at the glottis. So we can understand that within the English stops, we can also find the nasal stops, m, n, and n. These are nasal stops that can be either bilabial, alveolar, or velar stops. So the English stops, all of them, bilabials, alveolar, and velar, and the glottal stops, all these stops are actually to be given the distinctive feature minus continuance. Why? Because the air is actually stopped, not continuance. The release of air is actually blocked, it's actually stopped, so we give them the feature minus continuance. Minus continuance means stops. Those sounds which in their production the air is completely stopped. As for the second category or second way of the airflow release, friction, we can find also another category of sounds we call fricatives. What are fricatives? Fricatives are actually sounds which in their production the airflow is so severely obstructed that it causes friction. When they are produced, actually, the air escapes through the teeth or a small passage, making a hissing sound. That friction. These sounds are actually called fricatives. So what are these fricatives? What are the sounds that are actually to be considered fricatives? We have 5 types. We have the labiodental fricatives f and v. We have the dental fricatives th and th. We have also the alveolar fricatives s and z. We have also the palatal alveolar or the palatal fricatives sh and j. And we have the glottal fricative h. These are exactly the fricatives th, v, th, v, s, z, sh, j, and also h. These are fricatives because in the production of, or in their production, we don't have a total obstruction of the air. We do have actually obstruction, but the air escapes through the small passage, causing what we call friction. So if stops are given the feature minus continuance, fricatives are given the feature plus continuance. So all of these sounds are given the features or the one feature plus continuance. F is a plus continuant, V is a plus continuant, th is a plus continuant, the also is a plus continuant, while all others like the stops t, d are actually minus continuants. Within friction also we can find another category we call affricates. So what are affricates? Affricates are those sounds that are actually produced by a combination of a stop closure which is followed immediately by a gradual release friction of the closure that produces an effect characterized of a fricative plus a stop sound. So we call them affricates. In English there are two types. We have ch and we have j. And as you can notice, ch is a combination of the t, which is a stop, a minus continuant sound, and sh, which is a fricative, which is exactly a plus continuant sound. The same case with j, which is a combination of two sounds. That the first one is d, that is actually a stop minus continuant, and j, which is exactly a fricative, which is plus continuant. So affricates are exactly about combination of sounds, stops plus a fricative. When we say an affricate sound, we talk about a sound that is actually given the feature plus dr. D for the delayed and R for exactly a release. Delayed release. The phonetic or the phonetic feature that we actually describe or we use in order to describe or refer to these type of sounds that we call affricates is exactly plus dr. Why plus dr? Because d refers to the delayed release that was actually made by the stop t or t, and the release or the r for release, which is actually referring to the friction, the releasing, the continuous sound that was actually either sh or j. So we call them affricates, hence we give them the feature plus dr. In approximation, which is exactly the third way of the airflow release, we can find another category of sound that is called approximants. What are approximants? Approximants are sounds whose articulators are found to be close together but not close enough to cause any turbulent airflow or friction. In some phonetic literature, these sounds are for w, y, r, l. These are actually called approximants because the articulators are approximating a frictional closeness, but no actual friction occurs. For these sounds, we can divide them into two. We have liquids and glides. The liquids are two, l and r. In the production of the sounds l and r, there is some obstruction of the airstream in the mouth, but not enough again to cause any real constriction or frictions. These sounds are called liquids. The approximants are divided into two. We have liquids and we have glides. Liquids are l and r. In the production of these sounds, there is some obstruction of the airstream in the mouth, but not enough to cause any real constriction or friction. These liquids are divided into two. We have l, lateral plus lateral, and r, central, which is minus lateral. The second one, glides, are actually w and y. Okay, the w sound and the y sound are actually sounds that are always preceding a vowel. They are always followed directly by a vowel and do not occur at the end of words. After articulating y or w, the tongue glides quickly into place for pronouncing the next vowel, hence the term glide. So these are considered actually as approximants. The y and w are approximants, but they are not consonants. They are minus consonantal, minus syllabic. They are glides. We call them semi-vowels. Another category of sounds that are very important while describing exactly consonants are what we call stridents and sibilants. These two categories are very interrelated. Stridents are those sounds which are characterized by an acoustic rather than articulatory property of its members. They have characteristically intense sounds. It's like the ones you use if you want to call someone, you say psst, or quieting someone, you say shh. You will notice that these sounds are actually that you're using in order to quiet or to call someone are sounds that are very audible to the ear. We call them, they are the non-interdental fricatives and affricates. They are f, v, s, z, sh, j, ch, and j. They are stridents. The second category is the one we call sibilants. Because all sibilants are also stridents, the terms are sometimes used interchangeably. You can find in some phonetic literature that sibilants and stridents are two terms that can be used interchangeably. However, the terms do not mean the same thing. The English sibilants are a more high-pitched subset of stridents. The English sibilants are s, z, sh, j, ch, and j, which means that f and v are actually excluded, which means that f and v are stridents but not sibilants because they are very low in pitch. So sibilants are exactly another subset of stridents. So for distinctive features, we use those sounds that are actually stridents. We give them the feature plus stridents. But those sounds that are actually not stridents, we give them the feature minus stridents. So generally, in order to describe the manner of articulation as the second parameter to describe consonants, we can divide consonants into two types. The first one is the one we call sonorants. What are sonorants? Are sounds with much less obstruction but are very high in sonority. They are very musical. These consonants or these type of consonants, we give them the feature plus sonorants. But the others are also called obstruents, and obstruents are the opposite. All sounds with a high degree of obstruction, which means they have a high degree of obstruction. So, which means that these sounds are not sonorants, are not musical, but they have like a very high degree of obstruction. So we give them the feature minus sonorants. So sonorants plus sonorants and obstruents minus sonorants. The sonorants are the nasals, the liquids, and the semivowels. The nasals m, n, and ng are actually plus sonorants, and because they are nasal, they are plus nasals. And the liquids l and r are also plus sonorants, but l is a plus lateral sonorant, but r is a minus lateral sonorant. Semivowels, the w and the y, are plus sonorants, but they are not considered as consonants. They are semivowels. We give them the feature glide. They are glides. So we refer to them as a minus consonantal, minus syllabic. Obstruents are three: stops, fricatives, and affricates. Stops, we give them the feature minus continuance. Fricatives, we give them the feature plus continuance. And the affricates, we give them the feature plus dr. The third parameter that is used to describe consonants is the one we call voicing. What do you mean by voicing? Voicing refers to the state of the vocal cords during the airflow. How are exactly the vocal cords during the airflow? There are two states. Either they are actually apart or they are together. When the vocal cords are actually apart, the air goes freely through the glottis without making the vocal cords vibrate. So no vibration. So we call them voiceless sounds. Those sounds that are actually produced while the vocal cords are apart are called voiceless sounds. But for those consonants that are produced while the vocal cords are actually together, and because they are together, the vocal cords or the air breaks through, making those vocal cords vibrate. So we call them voiced. So voiced consonants are those consonants that cause vibration while or in their production. So voiceless and voices. So voiceless sounds are those which are articulated while the vocal cords are apart during the airflow. The air flows freely through the glottis without any vibration of the vocal cords. These sounds are voiceless, like p, like t, like k, like s. They are voiceless because they make no vibration. So we give them the feature minus voice. The other category is voiced sounds. They are those which are articulated while the vocal cords are brought together. The airstream forces its way through and causes them to vibrate. So this vibration makes them exactly voiced, like the sound b, d, g, z. They are voiced, so they are actually to be considered plus voice. So to sum up, in this video we have tried to cover the three parameters that we use in order to describe consonants. The first parameter that we talked about was the parameter of place of articulation. Second one was exactly the parameter of manner of articulation. And the third one is the parameter of voicing. Thank you so much for watching, and please stay tuned for more coming videos. Take care and bye-bye.